in the morning and on forcing him to go for bath. When I am reading this, it looks like I am reading the Metrioped of Heredity. Most of you would have guessed it right. He suffered with atopic eczema at 3rd-year age and was treated with allopathic medicine. Okay? So we have given anti-crude. Anti-crude. There are so many sulfurs in our Metriopedica. The original sulfur, metallic sulfur. The crude sulfur, this is anti-crude. The animal sulfur, sepia. Even lycopodium also has got spores of sulfur. Okay. Symptoms of cold subsided completely, but developed few eruptions on right antecubital fossa, as if probably it is bringing it back. So we have given SL. Again 1 more month, mild cold symptoms recurred. 1 more dose of anti-crude, which gave quick relief. So this boy was completely relieved of cold. So there is no question of headache. And the point is, like, this was 2 years back, if I remember well this case. After that, it doesn't mean that he did not get the cold. He got at least 3 times or 4 times cold attacks. First thing, the parents were not so panicky. Second thing, the cold has subsided again with any other medicine, whatever, mostly in anti-crude only. The other important thing, he never developed a headache. So they took it for granted it will be a just simple attack of cold like any child suffers, and it was over. So the headache did not appear at all, but the case which we have treated was headache case only, headache without headache. Okay, case 2, 32 years, beautiful lady. Why I wrote beautiful, you will learn later. All ladies are beautiful. You take it in right sense. Anyway, headache since 4 years. Though she mentioned headache since 4 years, but she had only 1 episode of headache. Only 1. And once. At temples, as if being pressed hard, no nausea, no vomiting. In the morning, Dr. Asrani sir was telling, if there is no nausea, no vomiting, it is not migraine. He is busy there, so I can talk anything about it. Okay. Amalgamation going out in open air. Travel to Delhi to show to a neurologist in AIMS. What do we understand? These people would analyze that beautifully. From Hyderabad, she travelled as if there are no neurologists in Hyderabad. Quite a lot of neurologists in Hyderabad. But yet, she travelled to AIMS. She told AIMS is number 1, so I went to AIMS. Number 1. Wants everything, student number 1. Right? So, normal except menses, very black bleeding. Now you got the remedy. 1 male child, cesarean section. Okay? एक ही जगह कह या आपका आता है पूरा? First history miscarriage 1 at 3rd month. Suffered with many sequelae after the miscarriage. She told at least for 15 minutes about the suffering about after miscarriage. So many problems. I am giving you the abstract. I don't want to give the whole length of all the case taking and all that. Okay. I am not against these people giving a lot of case taking, but I don't have patience. Okay. Please don't mistake me. Tomorrow you don't write in your editorial that he spoke all against us and all. I should please her because she is our editor. So many sequelae after the miscarriage. This is very important here. Family history, father died with prostate cancer. Okay. Now, when she came to the clinic, though she complained headache as her presenting complaint, but she suffered with the pain only once, 4 years back. And now what is her problem? Why should she seek treatment when she suffered with headache only once? Because she has tremendous numbness. She gets, I feel probably headache may be better, I don't know. But it becomes so numb. I feel very heavy here, it becomes numb. When I pinch also, I feel as if I am pinching somewhere on a crocodile skin. How many of you have gone to Rama knows? Crocodile Bank in Chennai? 1, 2, 3, 4, 5, very good boys. All girls only, no boys. Okay. So, there is one beautiful part, they would agree. At the reception counter, there is a huge crocodile skin attached to the wall. And the beautiful slogan says there, please touch me. Most of the places don't touch. But here only it says, please touch me. And many ladies would go back, as if it is alive and it will eat. So likewise, okay? So here, she said like as if she was pinching a crocodile skin, very severely numb, numbness. Now numbness replaced her head. Now she suffered with headache, she said. But she says, she asked me a question, whether this numbness is because of headache or is it part of headache or is it like headache? I said, I need to understand it. Little different, because it is different expression. My friends would understand it little later in different slides. So till then we will wait for it. Coldness of head with numbness. With numbness, the head feels so cold, very cold. Right? We have seen one advertisement where Amitabh Bachchan applies that oil. What is that? Navratan oil. So I purchased once. I kept it here. It's so like it, you feel very cold. How long? How much? I said okay, I don't want to. So it's very cool, right? So, but this coldness is so severe, she couldn't bear it. So no headache, but refers it as headache. This is also a case, headache without headache. You're feeling cold? Coldness all over the body or only head? It makes her weak and she takes some analgesic which does not give full relief. This is another problem. As morning there was a discussion that there is one condition which you can read in Alston's textbook of medicine. It is called as analgesic nephropathy. A type of nephropathy would be developed because of analgesics which are used left, right, center. In America they use Tylenol like peppermints, and here people, Dolo 650 fellow would have purchased 650 flights, A320. So that's how they were abused, right? She spends more time in parties, especially when she does not have head problem. She is a party goer, loves to spend more time. That's the constitution. Her husband is a big businessman, but what is the problem? Today we have seen Hema standing here, but her husband was standing little at a distance. He was afraid. I told him, why should you be afraid in public? There are so many people. They can protect you. You should be afraid at home. Please, okay. But not in public. It's really insult to the whole mankind. Okay? Mankind. Not mankind means good. Huh? ये 3 बार हेमा ने पूछी है कि आप खाएंगे, एक बार भी नहीं लाए. आप खाएंगे कहेंगे मैं यहाँ गेस्ट हूँ तो खाऊंगा कैसे बोलूँ? तो वैसा प्रॉब्लम. Anyway, yet he cannot open his mouth in front of her. She gave mic and said, "अब बात करो." She did not allow him to talk first. You would have observed there. That is her constitution, right? He says that she can scold him anywhere, hence he is careful. It is not about man. आपके हस्बैंड कहाँ है? आपके हस्बैंड कहाँ है? घर में काम कर रहे हैं. अरे बाप रे. Nobody will be so bold to tell. पेंटिंग कर रही घर का. ये और भी खराब. अर्बन क्लब वाले रहते हैं ना, वो लोग ठीक है. She is very moody, wants excess sex sometimes, and sometimes sends him out. We have given platinum 0/1. Basing on the whole picture which we have understood thoroughly, I can tell the whole story of this lady. It's all picture of platinum, very easy. At times it becomes very easy to select the right remedy, but it becomes difficult in many times, many cases. It would be difficult to point out which drug. Probably you may need to give one drug, later another drug and all. So platina and Lyco scored high. When I have prescribed platina, I told my assistant, anyway you take the whole picture, do the repatriation and tell me whether am I right or wrong. But she said so platina is also there and Lyco is also there. Both poles apart, but yet they scored. That was there, but we didn't think of it. After 1 month CHCM remedy, 0/3 for 2 months, almost all her symptoms got relieved. The platina relieved, her numbness, coldness has gone. She never complained of her headache problem. Now we should treat her husband if he comes. And Maruti 800, no, non-AC, perfect. So we used to keep, when I used to drive, I used to keep my hand on the window, all of us, okay, common experience. After some time, I developed numbness in my fingers. Then I asked my uncle, who is a neurologist, "Arey yaar, ye kya ho raha hai? How do you drive?" I said, "How do I drive? There is a driving license, I drive there." I said, no. Are you keeping the hand outside? Yes. That is the problem. Remove the hand. It took a lot of time for me to get adjusted. Like this. Like this. It was little difficult, but anyway, adjusted, then the numbness gone. But here, this is a different one. He wants a natural air, and weakness in his right arm of the body is present always, but more on exposure to cold weather and due to any mental exertion. He was taken to the nearby corporate hospital, and after all the investigation, it was diagnosed as right hemiparesis oblique transient ischemic attack. This was the diagnosis initially. He is not a known case of diabetes, hypertension or thyroid dysfunction. With continuous treatment, his weakness has come down for few days, but recurred after 8 days. Few days, a week. So it recurred later. His weakness still persisted. Then only he came to us. Had it been cured, he would have come to us. Allopathic dosage has been increased. Whatever the drugs they have given, some ABCDEFGH, they have increased the dosage. Some 200 to 400, 400 to 600, something. Yet the weakness has not gone completely. Review with a reputed neurologist revealed it as migraine. Diagnosis: migraine. Did he ever complain of headache? So headache without headache. Again, the case of headache without headache. Appetite reduced, thirst increased. आप सो रहे? Okay. Bowels regular, sleep disturbed, covers fully all season, desires spicy food. At times we should wake them up. Otherwise, head injury in 6th year, typhoid, chicken pox, hypertension, IHD, diabetes, all these things. No headache, but diagnosed as migraine. Whenever we call a migraine, we think it is headache. But migraine can be without headache. That's my intention. So we have given causticum 0/1, then causticum 0/3. In fact, China and sulfur scored high. As I already told, it was done posthumously, not the patient's death. But after the drug was given, it was done later, and there we found China sulfur. Okay, we thought, let us keep it in reserve.
5 minutes more.
5 minutes. Thank you. So I should talk for 5 more minutes. Okay, causticum 0/6. As there was complete relief of his symptoms, he was given sulfur 200 to wind up the case. Weakness has gone completely. Hahnemann tells, wind it up with an antisoric, and it was so classical that sulfur was there in the list. So I gave him sulfur, and he was completely alright. So here, this is a headache without headache. What is that? That's called a silent migraine. There is a class of variety in migraine, which is called a silent migraine or encephalic migraines. Migraine without headaches. They they don't involve the typical headache. They may be present with other symptoms such as aura. There may be visual disturbance. He gets the visual disturbance, but he doesn't get the headache. It is absent. So when he gets the aura, he is getting ready. I may get headache, I may get headache. He won't get it. Like when we see chocolate ice cream in the hand of a person, we think we will also get it, but we don't get it. Okay. So dizziness, nausea and sensitivity to light and sound. Okay, silent migraines can be difficult to diagnose because there is no headache. When there is no headache, to diagnose we need a specialist to make it as migraine. So they can still be disruptive and they can cause discomfort. Pain from a migraine can last anywhere 4 to 72 hours. Usually silent pain is absent. Prodrome phase can be there hours or a day before the migraine attack. They may have prodrome phase, aura. It could last for 5 to 10, 20 minutes. Then you have silent migraines where it could be due to some lifestyle changes. Like when you want to treat these silent migraines, in fact it is very evident in our day-to-day practice. If we adopt some lifestyle modifications, most of the chronic diseases can be tackled to a greater extent with the help of homeopathic medicine. So lifestyle modification is very, very important. Okay. Then the symptoms, it could be visual disturbances. It looks like classical migraine without headache. Silent. Okay. Silent killers. That is the problem. If a wife does not talk to the husband, it is more Ukraine war than real Ukraine war. That is the problem. Sensitivity to light, numbness or tingling. This is one case which we have seen, causticum. Numbness. It could be tingling also. It can be weakness, severe weakness. Numbness we have seen in platina and weakness we have seen in caustica. Sensitivity to smells, nausea and vomiting. Common prodrome symptoms like food cravings, irritability, fatigue and neck stiffness could be there. So what to know about silent migraines? These are all like, if you have any doubts, ask Dr. Rajini.
One
Thank
minute
you.
more.